Welcome back to our channel, where we bring you the latest information on parenting and child care. Today, we have an important topic to discuss that concerns every parent out there: the necessary vaccinations for your baby. Vaccinations play a crucial role in protecting your child from preventable diseases and ensuring their overall health. In this video, we will highlight 20 essential vaccinations that are recommended for your baby's well-being. Point 1. Hepatitis B vaccine. The first vaccination your baby should receive is the Hepatitis B vaccine. This is typically administered at birth to protect against Hepatitis B, a viral infection that affects the liver. Point 2. DTaP vaccine. We have the DTaP vaccine, which protects against diphtheria, tetanus, and pertussis, whooping cough. These diseases can be severe, especially for young infants. Point 3. Hib vaccine. The Hib vaccine is essential to protect your baby from Haemophilus influenza type B, a bacteria that can cause serious illnesses such as meningitis and pneumonia. Point 4. Polio vaccine. The polio vaccine guards against poliovirus, a highly contagious virus that can cause paralysis. It is typically administered in multiple doses. Point 5. Pneumococcal conjugate vaccine. The PCV, Pneumococcal conjugate vaccine, protects against pneumococcal diseases, including pneumonia, meningitis, and ear infections. Point 6. Rotavirus vaccine. The rotavirus vaccine is crucial in preventing severe diarrhea and vomiting caused by the rotavirus, which can lead to dehydration and hospitalization. Point 7. MMR vaccine. Your baby should also receive the MMR vaccine, which protects against measles, mumps, and rubella. These diseases can have serious complications and are highly contagious. Point 8. Varicella vaccine. The varicella vaccine safeguards your baby against chickenpox, a highly contagious disease known for its itchy rash and potential complications. Point 9. Hepatitis A vaccine. We have the Hepatitis A vaccine, which protects against Hepatitis A, a viral infection that affects the liver. This vaccine is usually given in 2 doses. Point 10. Influenza vaccine. The influenza vaccine is recommended annually for babies older than 6 months to protect against seasonal flu strains. Point 11. Meningococcal vaccine. The meningococcal vaccine guards against meningococcal bacteria that can cause meningitis and bloodstream infections. Point 12. Tdap vaccine. Your baby should also receive the Tdap vaccine, a booster shot for tetanus, diphtheria, and pertussis, around the age of 11 or 12. Point 13. HPV vaccine. The HPV vaccine is important for older children and adolescents to protect against human papillomavirus, which can cause certain types of cancers. Point 14. Meningococcal B vaccine. The meningococcal B vaccine is another important vaccination to consider for protection against meningococcal B bacteria. Point 15. Typhoid vaccine. The typhoid vaccine is recommended if you plan to travel to areas where typhoid is prevalent. It protects against typhoid fever, a bacterial infection. Point 16. Japanese encephalitis vaccine. The Japanese encephalitis vaccine is essential if you live in or are traveling to regions where the disease is common. It protects against a viral brain infection. Point 17. MMRV vaccine. The measles, mumps, rubella, and varicella, MMRV, vaccine is a combination vaccine that protects against these 4 diseases. Point 18. PPSV23. The PPSV23, pneumococcal polysaccharide vaccine, is recommended for certain high-risk groups and can protect against pneumococcal issue. Point 19. Hepatitis E vaccine. Another important vaccination for your baby is the Hepatitis E vaccine, which protects against Hepatitis E, a viral infection that primarily affects the liver. This vaccine is especially recommended in areas where the disease is prevalent. Point 20. Rotatec vaccine. Lastly, the Rotatec vaccine is an alternative to the rotavirus vaccine and provides protection against rotavirus gastroenteritis, a common cause of severe diarrhea in infants. That wraps up our discussion on the necessary vaccinations for your baby. Remember, Vaccinations are a vital part of your child's healthcare routine and help safeguard them from preventable diseases. It's important to follow the recommended vaccination schedule provided by healthcare professionals to ensure your baby receives the necessary immunizations at the right time. If you have any questions or concerns, don't hesitate to consult with your pediatrician or healthcare provider. Thank you for watching, and we'll see you next time with more informative content. Remember, a healthy baby is a happy baby.